All right, I apologize for the delay. And what I thought we'd do today is talk about a cardiologist's perspective on healthy living, non-pharmacological approach to lifestyle changes. And the title is Eat Healthier This Spring. And as I mentioned earlier on, if you want to see the spring flowers and everything is blooming now, go to Rondebosch Common and you can see these beautiful flowers all around the common, and it is really something spectacular. One doesn't need to go up to the West Coast. So spring is the time of blossoms, new growths, and I think new beginnings, and it's a time to reflect on our old habits and how to adopt new heart-healthy routines. I'm indebted to a nutritionist, Sandra Pretorius from Pretoria, who works with us at the Heart Failure Society in how to educate people on ways to adopt healthier lifestyles to decrease different types of diseases, and heart disease is one of them. We're going to conclude with what I think is something that we've learned through this COVID period, is the sudden unmasking of significant diabetes in the population, but we'll come to that a little bit later. So we're going to say goodbye to winter warming meals such as soups and stews. We're going to try and give you ideas on how to prepare crisp, cool, and colorful meals, which are veggie-centric. There's no better time of the year to do this than to do it now. And there are a number of wonderful markets that we have in Cape Town. There's the mobile market at Montebello in Newlands. There is the Oranjezicht market at the waterfront, where one can find organic, if one wants to get organic, but one can buy fruits and vegetables in quantities that you'd not have to do when you go to the supermarket. So we can design, we are going to find a way to organize ourselves to adopt this healthier lifestyle. So I think the first thing we need to do is create a healthy eating environment. Clear out unhealthy foods and snacks, refined, high sugar, high salt, high fiber, and create a comfortable space to sit down and eat. And if we look at this slide that I put up here, is how to be strategic, how to use ingredients, prioritize fresh products, organize one's kitchen, organize one's refrigerator, avoiding food waste, freezing any leftovers for another meal, and put fresh ingredients that have shorter shelf life up first. And the important thing is to rely on veggies, fresh fruit, low-fat foods, eggs, and as little red meat as possible. One of the easiest and best ways to spring clean is to clear out our closet of unprocessed and minimally processed foods. These include, and eat more of the, whole unprocessed and minimally processed foods, and lean proteins and whole grains. If we look at grains, which are an essential part of this type of diet, the bran, the outer layer, the germ, the seed, and the endosperm are high in starch. Whole grains have all three parts and give us a diet that is including essential minerals, magnesium, iron, phosphorus, manganese, selenium. And it is my belief that one does not need to buy vitamins, because the only things vitamins at the supermarket or at the pharmacy does is make vitamin manufacturers richer. We get all the vitamins we need from a whole diet. And I'll start off with one of the things that I've said times before, is one should eat breakfast like a king or a queen. We should eat lunch as a prince or a princess, and eat dinner as a pauper. Most of our meals should be consumed in the daytime, because that's when we are active, that's when we burn calories and get away from the notion of eating large dinners. So we're going to have bran flakes, shredded wheat, oatmeal, replace white rice with quinoa, brown rice, or wild rice, and introduce barley or bulgur into our meals. Just as a suggestion for breakfast choices, You can have a savory breakfast, which includes vegetables. It meets the South African food-based dietary requirements of 2 to 3 portions a day. And here are some suggestions with whole wheat toast, with tomato, cucumber, mashed avocado, spinach, peppers, cheese on anything, and quinoa, or with roast butternut squash. Of the spring vegetables that have come in now, and if you go to any of these markets, asparagus are coming in, artichokes are just on their way out a little bit, baby marrow, courgettes or zucchini, and the rest of them, as you can see on this slide, I'm not going to go through all of them, are things that are available at the moment. A picture of, in the newsletter, of these wonderful vegetables that are available. I think one should approach healthy eating and healthy living by making one healthy change a day. You can't change everything at once. It's not the way that we work with it. So if you make small daily changes, you'll significantly improve your health. An extra serving of fruit and vegetable, and buy fruits that are available and small amounts so that they stay fresh. Choose nuts or for a snack, or make your own oven-baked vegetable chips. And in the recipe section, which I think Diana will share with us in a link later on, cut out any sodas and put water or sparkling water, and swap white rice or pasta for a whole grain such as brown rice, bulgur, buckwheat, or quinoa. One should cut out as much butter as possible using olive oil, cut out added sugar and sugary drinks. And a small tip, and this we notice here, you know, just before dinner, we might say, oh, we're a little hungry. Should we have, make some snack or it's something to eat before dinner? If you can put it off for 5 minutes and distract yourself, that craving will go away by itself, and one will be able to sit down and have a good meal. Practicing mindful eating. Come to the table with an appetite, but not when ravenously hungry. Do not skip meals if possible. Rather eat 3 small meals a day and start with a small portion. And appreciate your food. Pause for a moment or two before eating. Contemplate everything and everyone it took to bring to the table. And I think in our Jewish tradition, by saying grace before and after meals, this is one way of appreciating how, where, and food comes from, and express the gratitude for the opportunity to enjoy delicious food. And if you're with a companion, you're enjoying it with. Bring all your senses to the meals, especially when cooking, serving, and eating food. And it's always wonderful to have a colorful meal. And if you looked at some of the vegetables, you know, adding beetroot and spinach and butternut, you bring the red, the greens, the yellows to your meal, and makes every meal preparation and every meal that you're going to eat more appetizing. Try to identify all the different ingredients and the different seasonings. Small bites. These are just something which we should think about, and chew until you've tasted the essence of the food. And most important, if you follow the advice above, eat slowly. I think if one eats slowly, one will consume less food and achieve a healthier lifestyle. Fruits and vegetables. This is the time of seasonal fruits in September, October, November. Avocados. We don't think of avocado as a fruit, but it definitely is one. Apricots, guavas, lemons, limes, melons, peaches. These are all the things that are in season. You know, one of the things I noticed coming back from the United States was there you can get all these vegetables year round, but you're not eating them in season. So I think one of the things we like to suggest is to eat what is in season. Number one, it's cheaper. Number two, it's plentiful. Number three, it is healthy. And I'm going to go to now a different tack. You know, one of the things we've noticed in COVID is that there's been an unmasking in diabetes. And South Africa has now got about 4.6 million diabetics. And if one looks, sorry, for some reason my slide is, diabetes is the leading cause of death in the Western Cape. Diabetes was the leading cause of women in South Africa, and it's the second leading cause of death in men and women in South Africa. And the mortality and cause of death in diabetes, as you can see from this slide, is generally cardiovascular disease. And cancer, diabetes, renal disease, and others pale by the deuces. So if one changes one's diet, one cuts out sugar, processed foods, eats healthily, one decreases and brings a disease like diabetes, which is a silent killer, under control and will decrease cardiovascular disease. And the intervention for diabetes, and this goes to what I've mentioned before, is 5 to 10% weight reduction, exercise, getting one's HbA1c to target, controlling BP, lipid control, aspirin when indicated, and no smoking. One of the things I've noticed myself, being a person who has type 2 diabetes, is that through lockdown, by changing the diet, by changing everything else, my cholesterol has dropped significantly without having to take a statin. My HbA1c has come down to target. My weight has come down and has been stable. And I think this is one of the things that we've had as a problem in lockdown, you know, being at home, not being able to exercise, being slightly depressed, craving for different types of food that will raise our mood. We have unfortunately got ourselves into a situation where we are then predisposed to weight gain, sugar intolerance, and unfortunately increased propensity to heart disease. So I really believe that by making these changes, one can advocate a healthy lifestyle and do a lot of good for ourselves. I'm going to end here and open up for any questions on anything related to cardiology, to heart disease, to COVID, if you want to, and open that up to the audience. Thank you.
Any questions or comments for Tony?
Let me share one of my thoughts. Whereas I am, as we all are, very concerned about COVID and the effects of COVID, and I think unfortunately our community has been devastated by the effects of COVID. And I firmly believe in being vaccinated. However, I will tell you that I have, unfortunately, a skepticism about big pharma. We do not know what the long-term effect of the vaccine is and whether we're going to need booster doses or not. Certainly, big pharma are going to push for booster doses, and because that's how they make money. They are interested in our health, but they're also interested in what they can do for their board, their investors, and their stock price. And I really believe that it's going to take us a while to find out what the true effect of the vaccine is. At the moment, we know that it has a significant effect of decreasing the severity of the disease. It does not stop us from contracting COVID. The things that will stop us from contracting COVID is non-pharmacological means: masking, hand washing, sanitizing, and avoiding super spreader events, and being very, very cautious and trying to do things outdoors and not indoors, because that's the super spreader. Nancy, my wife's son, had been vaccinated and came down with COVID, but fortunately, it has been a very mild effect after the first 24, 48 hours, and he's on the road to recovery. We've noticed that the admissions to our hospitals, Groote Schuur, 99% of people admitted with COVID at this stage during the third phase are people who are not vaccinated. So I'd really like to encourage everybody to encourage your family and friends to get vaccinated. The vaccine is not the total answer to the problem, but it decreases the severity of the disease. And one of the things that I think I've noticed, and I wonder if you've noticed, that we haven't had flu this year. Our flu season has been very, very, very mild throughout the winter. Why? Number one, because we were locked down. Number two, we wear masks. And number three, we wash hands and sanitize. And I think we should continue to do this in the future. Life is not going to be what it was before. We're going to have to find ourselves a new normal. And whereas we are critical of the severe lockdown that we've had in South Africa, this was done for specific reasons. We do not have the capability in our hospitals that they have in more developed Western countries. And we had to do something to decrease and save hospital beds, like the alcohol ban, as drastic as it may be. The number of admissions for motor vehicle accidents, domestic violence, etc., during that lockdown decreased significantly. And I think these are things we need to reflect on. And I'm going to leave it at that for any comments and questions that anybody might
have. Tony, your previous list of problems, you mentioned lipid. Two very puzzled looks. Could you give some sort of an opening on that, please?
One of the things about lipids and the relationship between cholesterol and heart disease and myocardial infarction came out of the Framingham study. If you recall, the Framingham study was done from the town of Framingham, started in 1948, where they looked at 5,000 men and women, and they followed them for years until now. And they identified 9 or 10 factors that were significant in the cause of myocardial infarctions, heart attacks, and heart disease. Cholesterol was one of the 10. Now, because cholesterol was one of the 10, Big Pharma jumped on it straight away and started with what we now know are the statins. And they pushed as hard as anything for us to treat cholesterol levels with statins. One of the things that we were all fell for this. I was one in 1985 when the first statin, metformin, the lovastatin, came out, prescribed it very freely, until it occurred to me, what am I doing? And I then realized that cholesterol is one of the 10 factors. One of the most important factors in heart disease is your genes, your genetic. If father or grandfather had heart disease, your chance of having it is higher. So one had to then say to ourselves, which patients do we treat to bring the cholesterol level down? Which patients are necessary or should be put on statins? And we've come to the realization that one has to individualize treatment. Not every high cholesterol needs to be treated, because if you've got a negative family history, you're not diabetic, you do not have high blood pressure, you're a non-smoker, and you exercise and you bring your weight down and you eat healthily, you do not need to take a statin as primary prevention. Once you've had coronary artery disease, you've had a heart attack, or you've had angina, or you've required a stent or bypass surgery, that's a different ballgame, and that you then fall into a different category. It's been amazing to me how one can lower one's lipid level by dietary means. One of the ways that we noticed it was red yeast. Red yeast is something that you can buy tablets of red yeast, but it's found in wild rice and in the foods that I mentioned in the diet that I went through earlier that lowered the cholesterol. I mean, my cholesterol level dropped from something like 5.8 to 3.4 just on dietary measures. And I believe we can all do that. It's getting off processed foods, cutting down on fatty meats, etc. You can still eat meat once a week. One can still eat cheese, going for low fat, but it's portion size. And I think that maybe that will answer your question about lipids. Do you have anything else, Admiral?
Any other questions? Any other comments?
Tony, I'd just like to thank you for a very lucid explanation. we will take it from there. Thank you.
Any other questions or comments?
Tony, I think this is the first of our series, and maybe people are just unsure. But we really would like to make it interactive. It's much more interesting if we have both questions and answers for our presenter. I'm just looking at a blank screen at the moment with only Tony's and my face that is being visible. So if you'd like to show your faces, and just, even if you've got a comment on whether you thought this was worthwhile exercise, you know, we want to have these afternoons, but if they are not enjoyed, it's silly to push them. So we do need comments, even if you put it in the chat.
Can I add something to this? No, as I mentioned in the beginning, I'm a freelance cardiologist. I worked until COVID came out of 5 different hospitals. But one of the things that I learned, and I'm going to give you an anecdote. One of the people who influenced a lot of my thinking was my mentor, Professor John Barlow in Johannesburg, but Dr. Proctor Harvey at Georgetown University. And Proctor Harvey used to say that if something that we know today is still valid 5 years from now, then it's worth keeping. And many things that we have that come out are then debunked after a couple of years. Let me talk about 1 or 2 instances. The first thing is the propensity to have a stent. Now, a lot of people who have coronary artery disease and have angina will go to their cardiologist, and the cardiologist will do an angiogram and say, I found a narrowing and you should have a stent in. A study that came out at the beginning of this year from the United States showed that 70% of stents that are inserted in the United States of America are not medically indicated. That good, non-invasive medical therapy with drugs, dietary change, and exercise do exactly the same good as a stent in decreasing mortality. What a stent can do is, if one's having a heart attack, it will save your life. If you're having intractable angina or chest pain on exertion or minimal exertion or at rest, a stent is indicated. But otherwise, good medical treatment has the same outcome as stents. I've not yet seen that, except in an acute presentation with a heart attack, that stents do anything to change mortality or morbidity. That's number one. So I think one should really think about non-invasive treatments to do that. The second thing is, as a maverick cardiologist, I used to do house calls to some of my patients. And when I had patients who would come to me in heart failure, I had 2 or 3 patients where I did a house call because it was more difficult for them to come to the office. When I walked through the kitchen, I realized why they were having repeated episodes of heart failure, where I see what their kitchen was laden with soups and tinned and canned vegetables and canned things, which had 850 to 1,000 milligrams of sodium. No wonder they came in with heart failure. So I think we need to change the way we approach the way we treat people, the way we interact with people. I think the old-time doctor who sat down with the family and got to know the family and got to know the patient, that's a thing of the past, and that's something which we should strive for and change in the way we approach medicine. You know, unfortunately, doctors have been put on a pedestal, and I think it's about time they were brought down and be able to interact with patients and open to question and say, sometimes I don't know, because sometimes we don't know. And I'll leave it at that.
Okay, thank you for that. Well, I really and truly...
Diana, can I ask something, please?
Please, Shirley.
Okay. Tony, you spoke about low-fat foods. there's been quite a lot of talk about having full-fat cheese and full-fat yogurts and all this kind of thing. And I was just
Definitely.
wondering whether it was a publicity stunt or whether it's true.
You are completely correct. Unfortunately, low-fat foods like yogurts and things like that, if you look at the label, in order to make it palatable, they've added a lot of other sugars and additives to make it palatable. I believe if you're going to eat something like yogurt or anything like that, cheeses, you can eat full-fat cheese. This is my certainly belief, but it's portion size.
Okay.
I mean, at one stage, I ran an ice cream store with my youngest son off an island in the coast of Maine. And one of the things people said to me is, isn't that a conflict of interest? I said, well, firstly, I don't have a license to practice in Maine. But secondly, it's not the ice cream. It's the size of your portion. And if one has a regular single scoop, South African style, not a single scoop American style, you can get away with it if you eat it a couple of times a week and you do not binge on it. You're completely correct. And one of the things that blew my mind once was driving on the highway where a big truck came past me and it said, decrease your cholesterol, eat medium-sized eggs instead of extra large eggs. And that's true. Eggs can be eaten. It's portion size and it's non-processed foods. These are the things that make all the difference, because when you look at low-fat yogurt and low-fat things, read the labels and you'll be surprised as what you are ingesting.
Thank you. Thank you very much for that.
Right. Anybody else want to add or ask any questions? Okay, Tony, I really appreciate you coming on this afternoon. I know that you've said to us that you're available whenever we need to have you, and you've always got such sound advice in such a simple layman's terms that everybody can understand it, and we appreciate it greatly. So I know it's not a full hour this afternoon, but rather have a little knowledge or a lot of knowledge in a way that you can go away and dissect and put it all down and understand what Tony said. Next week, we'll try for someone else, and hopefully the series will improve or not improve, but become enjoyable, and people will be happy to talk more freely as we go along. But thank you so much, Tony, as always. And Angela Butlian sent a message in the chat to say thank you. So I do think it was appreciated. And hopefully we'll see more of everybody either on Zoom or shortly at our centers once again.
Diana?
Yes.
Can I ask?
I'm Malcolm, sure. Yeah.
4 years ago, I had what they call an AVR, aortic valve replacement. It's always puzzled me what was the possible cause of it. And okay, I assume it was a good thing that was done for me. Could you open up the explanation better for me? Thank you.
Yeah. Can I ask you a couple of questions?
Yeah, sure.
And I really think that, you know, I thought that we would do something as general as dietary, but I'd like it to be able to, for you, if you've got questions, these are the type of things that I am available to do. Number one, what is your age?
I'm now 77.
Okay. It is, if we all get older, and I hope we all do get older, at least 1 to 2 out of 3 are going to develop narrowing of the aortic valve. If you had your aortic valve replaced for aortic stenosis, which means narrowing of the valve, which means your heart has to pump against a narrowing, so it has to do more work. The common cause is degenerative aortic stenosis, where the valve has got 3 leaflets, 3 cusps in the leaflets. They open and close 60 to 70 to 100 times a minute. Over time, like the door of my house, it creaks, the hinges creak. It gets thickened, it gets calcified. and then it needs to be replaced. Generally, over age 65, it's what we call degenerative aortic stenosis. And it is life-saving. It will give you, depending on what kind of valve you got inserted and how they inserted it. You've probably got a tissue valve. You don't have a click, 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 click valve in your heart, a mechanical valve. And
sorry, I may just interrupt. Mine is bovine, number one, and number two, it was diagnosed as a leaking aortic valve.
Okay. Now, your bovine valve has a life expectancy of between 10 and 16 or 18 years. So you need to be followed up every year by your cardiologist, and you will get at least 10 to 15 years, because the newer valves do very well that way. The way that they are harvested and the way they are preserved has improved tremendously since the first Edwards valve came out in the 1970s. In those days, the valves only lasted 3 to 5 years, but this time you're going to have a very good long-term valve in your heart, and it makes a tremendous difference. I mean, as I say to a lot of patients, if if something happens to your car, you don't go and replace the whole car. You fix the thing that's the problem. And in aortic stenosis in men over the age of 65 is not uncommon and is something that is very easily reparable. And nowadays, depending on the risks, they can do it without opening your chest. They can do it through the groin, as we call it, TAVI, transaortic valve implantation. So things have moved tremendously to decrease the risk, improve the patient's recovery time. With TAVI, people go in and within 48 hours, they're home and they're walking around, not like an open heart surgery. So that's the way things have progressed over the last 2 decades. Have I answered your question?
Thank you very much.
Thank you, Malcolm, for the question and for the answer, Tony. Any other questions? Suggestions? Okay, I think we'll leave it there. And as I said, thank you, Tony. And
Diana, can I just ask, if people can put in the chat or with you what they'd like to be discussed, I will do, I can tailor it to what they wanted to do, whether it's heart related or anything cardiac related. They wanted to ask questions about anything, we can have a question and answer session, and they can just communicate with you. You can send it to me and we can set up a session that way to meet their questions and their needs.
Okay, that's a good idea. If you don't want to put it in the chat sessions now, you're welcome to email me or send it to Amanda, and we can do a session so that it is something that you want to be part of and your questions are answered. Really, it's as simple as that. We want to help you all to, feel comfortable. Thank you.
And I hope you're going to share the link that I sent to you.
When did you send it, Tony?
It was sent about half an hour just before the talk for the Heart Failure Society, the recipe section that I sent you.
Okay, so it's by email.
By email, if you can share it with
We'll forward it to everybody with pleasure.
Okay, fine. Thank you.
Thank you.
Thank you all.
Okay, thank you for joining us, everybody, and look forward to it. Tomorrow, we've got a fascinating series starting on communities in South Africa by Dan Lachman. It's an 8-part series. So hopefully you'll join us. And as you receive the sessions for the whole week, please join us whenever you can. Stay well and see you soon. Thank you. Thanks, Nancy and Tony.
Thank you. This is your computer.